Hi, my name is Amanda Panacea, and you're listening to the Healer Revolution podcast. This is a community for self-healers, biohackers, practitioners, and any other helping professionals. You're in the right place if you're seeking conversations about how pain becomes passion, the connection between physical, energetic, mental, and our spiritual self, finding your body's ancient wisdom, the latest biohacking technologies, clinical research, and if you just want to nerd out about complex biochemistry and quantum physics. But this is also for entrepreneurs who seek infinite abundance and a supportive community. So pour a cup of King coffee or Sisters tea and let's join the revolution. Hello, everyone. Welcome back to the Healer Revolution podcast. I am Amanda Panacea, and today I'm really thrilled because I get to sit down finally with the Lauren Keller. She is a nurse practitioner, certified nurse midwife, and chronic illness specialist. And I say finally because I have been following Lauren for probably 7 or 8 years now. She was one of the first practitioners that I found on Instagram when I was going through my hormonal illness and trying to figure out the complexities of complex chronic illness. And so I have been following her work for a very long time. She's had her own chronic illness journey as well as her own infertility story. And so for this podcast, we are focusing on fertility, pregnancy, babies, birth, what's actually happening underneath the surface when the body is struggling. So we're going to talk about root causes of infertility, mineral imbalances, nervous system health, quantum biology principles, and just basically the overall physiological impact of some of these things and how they affect conception, as well as do you need to detox before you get pregnant? What to expect with birth, postpartum, and really how to support the body through each phase in a more grounded, foundational way. And also while trusting as a female that you are capable, that your body is meant for this. And as someone who wants to get pregnant at 40, I really appreciated this conversation, and I hope you all do too. Hello, everyone. Welcome back to the Healer Revolution podcast. I am Amanda Panacea, and today I'm really, really excited to be able to finally sit down with Lauren Keller. Hi, Lauren.
Hi, how are you?
Good, good. I've been following you probably for like 8 years, and I'm so glad we finally get to sit down and have a full-blown conversation. I get to pick your brain a little bit about all of your knowledge.
Absolutely. And I'm excited because we're talking about my favorite topic, which I actually don't talk about that much on social media. So this will be good.
Yeah, yeah, awesome. So yeah, we're going to talk about fertility and pregnancy and postpartum a little bit on this podcast. But before we get into all of that, tell me your story. Like, how did you get into root cause and then fertility and everything we're going to talk about today?
Yeah. So I'm a nurse midwife. I worked in the hospital system for about 8 years, delivered babies at home and in the hospital. And when I was like 25, I just started having massive amounts of symptoms, like kind of overnight, actually, like from one day to the next. Before that, I had endometriosis and like some signs that we know now are signs that our bodies aren't doing well. But at the time, it was just like, oh, my periods hurt, for 2 days, and then I go back to normal. So it was like from one day to the next, I just started getting like chronic headaches, massive fatigue, difficulty swallowing, anxiety attacks, like panic attacks out of nowhere. Um, I don't know, you name a symptom, and I probably had it at some point. Um, and then you go through the whole Western world, right? And so at one point I was diagnosed with multiple sclerosis, and then you kind of go into the root cause world, and at that point, like Lyme disease was just like the thing that every single person had, and so did like a year and a half of antibiotics, which is just so painful to think about. Yeah. I saw like an LLMD, did the whole antibiotic thing. It didn't get anywhere. It just got worse. And then once you realize that other people don't have any answers, I think, just like your story, like we have to just find our own answers. So I just went out on my own and found out my nervous system was really jacked from a lifelong history of trauma and, living with a bipolar mother and what that does to your nervous system. And then finding all kinds of issues with my microbiome and minerals and all the things and eventually recovered. And then I still struggled with very low hormones. Like that was always, I think most women now have too much estrogen because of all the plastics and things. And I had no estrogen, like postmenopausal estrogen levels. And so I always had infertility, like had unprotected sex for forever and ever with no issues. And then I had cavitation surgery um, at 36 and got pregnant 2 days later. So it
Wow.
was like the block still. I had done so much work up until that point, and that was like the thing. Um, so yeah, that was wild.
Yeah. Was that surprising?
Yeah, we were not planning on having a baby. I had sort of just come to terms with the fact that we weren't. I'm an Enneagram 5, so I'm very fine just
Same.
like
Yeah.
being home and like reading a book and having like a chill life. And so when I found out I was pregnant, it was like devastating. I actually started crying and was
Wow.
very upset about it. And
Mhm.
at that point had considered termination, like even though I felt like in my heart that wasn't like a correct thing to do. I just was like I had lots of nausea in the first trimester and I just was like overwhelmed by the prospect of having a kid, and I was scared because of all the chronic illness stuff, like what's going to happen and how am I going to
Mhm.
handle this? Is my health going to go backwards, which I think is a common fear. Um, and so I was really upset about it. And then we did. We had a really rough postpartum journey. Not, but surprisingly not physically for me, so much. There was some fatigue. But it was more for my son. He had a lot of health issues, and we had to kind of navigate the Western healthcare system, and there was just a lot of fear and overwhelm in the postpartum period. But surprisingly, my physical body did pretty well. So
Amazing.
yeah.
Yeah, so let's backtrack a little bit. So the tooth that you got removed, was that connected to like ovaries or anything like the meridians? Did you look that up?
So I had my wisdom teeth removed when I was 17. And it was
Mhm.
like they put me full out under anesthesia, and it was a really brutal procedure. Like I don't know what this dentist did. And so he removed all four of the wisdom teeth, and I don't really know why. I feel like they just do that in the States, or they did, like in the 90s. Um, and so after the surgery, I had dry socket in three out of the four. And it took me a very long time to recover from that surgery. And so when I found cavitations, um, I had the 3D cone beam scan, and they were like, you have cavitations in all four of your wisdom teeth. And one of them was really severe. It was like my bottom right. Um, and when I had the surgery done, I did it completely awake. And when he drilled into that area, I just had like a huge emotional release. Just started bawling. It was like I just like had like a flood of childhood trauma come up, and I was like hysterically bawling. And the dentist was so kind. He's just like, okay, we're just gonna stop. And he just sat there like that. And they just let me cry for like 20 minutes. And then I just went into this like total like parasympathetic response. And I was so calm the rest of the surgery. And it was like a 3.5 hour surgery, wide awake with your mouth open the whole time. So it was kind of
Wow.
brutal. And I just went into like the calmest state. And so I don't think that this wisdom tooth is necessarily directly on the meridian path for like ovaries. But it sure shifted something.
Yeah. That's really incredible.
Yeah.
Because you got your wisdom teeth out at what age?
17.
Yeah, that's not like really young. I mean, I've worked with a lot of people who have severe panic and phobia like about the dentist, and like the first time they went when they were little is really traumatic. So I wonder, like, were you always afraid of the dentist prior to that, or did you have other dental things going on?
No, I've never had a cavity in my life, never had root canals, like never, nothing.
Interesting.
So, I don't know. It was just like so much trauma trapped in in this one tooth
This one's
that
good.
was like blocking my fertility because I
Yeah.
literally got pregnant 2 days later and everybody says like you were having sex like 2 days after dental surgery.
Yeah.
And I was like, I can't explain it. Like I had this huge trauma release. I had so much energy after the surgery. I mean, I was like a chipmunk, but I felt awesome. So, so yeah, we had sex and that was our
It
conception date.
works. Yeah. Cool. And then, so you were obviously like in the baby world prior to this. What called you to go into that in the first place?
I love pregnant women. I so my first graduate degree was in clinical psychology and was going to go into marriage and family therapy and it wasn't for me. Like as soon as I finished school, I was like, I am not going to do all of these hours and spend 3 years doing this. It's just not for me. And so right afterwards, I just knew I wanted to go back and do something with pregnancy. I thought about going to med school, but the whole not just the process of med school, but just obviously like the theory around it just never settled right with me. And so I ended up deciding to go into a midwifery program, and I loved it. Like loved it. I miss it so much.
Yeah. What do you
Um,
like about it?
I don't know. There's just something amazing about pregnancy. It's like even though I've seen hundreds of births, attended hundreds of births, I think every single time I'm always like, there's no way this is gonna happen. And then it just comes out and you're like, wow, you just grew this like a whole human. You grew it in your body. It's just wild, like organs and limbs and fingernails and hair. I don't know. I've just always been fascinated by it. And I just love touching pregnant bellies. I love birth. It sounds gross, but even like the smell of birth, like there's just an energy and like a smell about birth. Not like the vomit or whatever that women do sometimes when they labor, but just like, I don't know, I just love the energy of birth. It's just like a renewal period. It's beautiful. I don't know. Yeah.
Yeah, I mean, if you think about it, it's like a portal opening for like a new consciousness to come to Earth. It's really
Yeah.
insane that women are so powerful like that.
Yeah. I mean, it's no wonder our birth culture is the way that it is, like trying to block the humanity of the process and the like divine nature of it because
Hmm.
it's incredibly powerful when you can actually feel that and see women birth and how powerful they are and yeah.
Yeah, incredible. So let's get to actual fertility. So obviously, we've heard like over the last, I would say 20 years that women are becoming more and more, struggling more and more with infertility. Why do you think that's becoming more and more of a reality for a lot of women?
Ugh. I mean, the list kind of goes on. I think the most recent study I saw from 2025 said that about around 4%, it's a little bit less than that, of women are experiencing infertility worldwide. They did a study looking at 240 different countries. And then and this is for women, and then the rate of infertility for men is around 2% now. So it's high. And they didn't have any estimates for 2040, but I mean, the projections are that it's just going to continue to increase from there. So I think, in our world, like all the root cause stuff is, tons of studies came out between 2020 and 2025 looking at heavy metal toxicity and the different effects that it has not only on the fetus but on just the ability to get pregnant. What that effect is on sperm motility and morphology is huge as well. I think metabolic syndrome is massive in our society. So lots of PCOS, lots of hormonal imbalances, lots of glycemic issues, insulin resistance. Um, Anemia is a big one. Can lead to a lot of low birth weight, preterm birth, postpartum hemorrhage issues, lack of exercise. You put somebody on an exercise program and you see a rebound in their fertility and a rebound in their hormones within like 3 to 4 months of just being on an exercise program. Nutritional deficiencies, mineral deficiencies, the list is long. So I think we have a lot going against us, unfortunately.
Yeah. And then, of course, not to mention the chemical soup that we've all been exposed to, leading to some of those conditions as well. And just not being able to escape like
Yeah.
glyphosate and things like that
It's
ever.
it's crazy. And then even not just the physical stuff, but the mental health stuff too is huge. Like I think, we grew up in the 80s and 90s, like our generation, and we were just told like boss babe, like get a degree. Having children is, but behind the times. That's like what women did, 50, 60 years ago. And so I think this kind of energy too has kind of progressed in society and really caused us to struggle with motherhood and infertility.
Yeah, I'm glad you brought that up because I've been seeing a lot of Gen Z content talking about how like it's embarrassing to have a husband or a boyfriend and like men in general are gross and not saying like homosexuality or being a lesbian is what they were referring to. These were straight women who were literally like, no, I don't even want to have a man in my home. Like I don't need a man and like just like seeing how young they are and hopefully like that will shift as they get older because I definitely experienced that too. I think a lot of women in like feminism and yeah, I'm going to be my own boss and I'm going to be a CEO or I don't need anybody, I'll take care of myself or even like sex industry and like I'll use men and get what I need from them. There's so much of that hookup culture that just has really shifted like the dynamics of men and women and how they actually work together to have these healthier, happier children and homes for the future.
Absolutely. I think it's both though. I've also seen this amazing like rebound
Mhm.
of people like really desiring kind of more traditional femininity and masculinity. And I think one of the good things that did come out of it is that men are way more intimately involved in raising their children now. At least that's what I see in like our bubble. I don't know what it's like in the wider society, but because men traditionally like went to work, back in the 50s and 60s and women stayed home, I think the kids didn't really get like I never saw my dad. I mean, we saw him on the weekends, but then he went golfing all day Sunday. So it was like I spent zero time with my dad. Um, and now I feel like men have stepped up in a way these last few, I don't know, decades and are spending more time with their kids or finding more value in that. So
Yeah, that's definitely true. I think there's both happening for sure. And
definitely.
yeah, I agree. My dad worked to the bone. Like sometimes he'd work 14, 16-hour days. And then, maybe would show up to one of my swim meets a year because he was always working.
Yeah.
Um, yeah, so let's get into okay, you have PCOS or you have endometriosis or you've been trying for a baby and it's been months to years and it's not happening. What are some of those foundational things that you can do that maybe your regular fertility doctor is not going to tell you about, like lifestyle wise, that you can shift?
Yeah. So I think a big one is getting your mineral stores up. That's a huge one, which we both know about. Whether that's in the context of traditional mineral balancing or just really working on mineral status in general. The baby's going to take they estimate kind of between 15 and 20% of your mineral stores, which is a lot.
Yeah.
And so seeing mineral, HTMA tests that we've seen and seeing how depleted women are now. And now I see HTMA tests on children and they're, in very low mineral patterns, 4 lows type patterns. And you know that they just didn't get that transfer from mom. So definitely working on mineral stores, working on nutrient density in your diet and lots of diversity to improve the microbiome. Um, I think, in our bubble, we just assume everybody's eating healthy, but I think in the larger bubble, most people are not eating healthy and not eating nutrient dense foods. And then there was an interesting study, I don't remember what year it was published, but looking at the amount of seafood a woman eats, and it has a direct correlation. Like the more seafood the woman ate, the higher the intelligence rates in the baby, the IQ rates. And there wasn't like an end to that. So it's just like the more seafood, the more intelligence. Which is interesting because we always think like seafood with the mercury content and things. And I still do think there has to be caution there, but I think starting to introduce some seafood. I really tried hard in my pregnancy to do that because I hate seafood.
Oh yeah.
we weren't a seafood family, and I think when you don't get that flavor when you're little, it's hard to incorporate. But eating like, sardines and some of the lower mercury fish. Doing some level of detoxification. I don't think people should be out there doing like these aggressive protocols, especially if you're trying to conceive within the next 6 months. We know that this like pushing, pushing, pushing attitude has kind of become the norm in the wellness community, but can often backfire, especially when people have, mast cell or other issues. Doing some microbiome testing and looking at the microbiome, making sure that there's a good breakdown of beneficial to commensal bacteria. We pass our microbiome on to our babies when we deliver them, and so lots of babies have colic and reflux and issues now. And I do think part of it's emotional, but I also think a part of it is microbiome issues in children. Um, Making sure you're looking at iron stores as well. So many women have like really high ferritin or really high iron, or the opposite and have very low. So making sure that's regulated, because you can see lots of low birth weight or preterm birth with iron issues. Blood sugar regulation. So that kind of goes along with nutrient density, but also making sure you got the circadian rhythm piece, making sure you're in the sun every morning and blue light blocking glasses at nighttime and all the things there with their circadian stuff. Exercise, not too much, not too little. Lots of women that do, just like hit workouts constantly or not to throw shade at CrossFit, but like doing just intense CrossFit workouts or distance running, they tend to not ovulate very well and tend to have issues in their pregnancy or at least getting pregnant. Um, and losing weight if you can. So obesity is something even in the Western literature that leads to a lot of issues in not just in fertility, but in pregnancy as well.
Yeah. And kind of back to the minerals. So I had a friend who was kind of like sick a lot in her life. Like she always, a couple times a year, she'd have like a bad cold or a flu.
Mhm.
And I was like, just take this one mineral supplement. Like just add this in. She didn't get sick for a year. And she was like, I made it a whole year without getting sick. And then she got pregnant on the first try.
Wow.
She was like, it was because of that supplement. It was just trace minerals and electrolytes. That was it.
It's crazy, right?
Yeah, so she didn't do anything major to prepare, just literally added in some really basic nutrition. She was probably
Yeah.
lacking.
I mean, it's kind of why I made the fertility course because I think we sometimes live in this like wellness bubble where we just think that people already know all this stuff or are doing all the things. But when
Hmm.
you like step outside of that, like when I worked in the hospital system, I was like, whoa, like people don't know anything about any of this stuff. They don't even know like what minerals are, where they get them, what a nutrient dense food is. Like nobody
Hmm.
has any of these concepts. And so for some people, it's like they go through this whole Western medicine rigmarole with IUIs and IVF and all the things. And I'm like, well, maybe you just needed, some minerals. I don't know. So it's wild.
Yeah, and I have another friend, untreated anemia for probably 30 years at this point, like tw 25 at least years. Like in high school, she had anemia. Like, what? No one has helped you with this in all the doctors you've been to your whole life. It's
Yeah.
just really sad. Um, okay, yeah, so what about someone who might be like doing all the things, eating really healthy? Are there any like things that really stand out as like, maybe like a weird or rare thing that you need to check on? Like I know I've worked with some women who just starting, even just taking a thyroid medication helped them get pregnant. And they had been resisting doing that for years because they were trying to do everything naturally. And like that was the thing. Is there anything like that?
Well, I think that's definitely one. I think
Hmm.
looking into possibly genetic stuff. I know we'll probably get into like a little bit of the EDS stuff, but EDS for sure.
Yeah.
Um, and what is all the things? I think, if you're doing like all the things, like eating healthy and have a good exercise routine, you're a normal weight, your glycemic, index is good. Those are what the things that I would consider basic. Then that's when you kind of go deeper and you're looking at, okay, like what's actually happening to your thyroid, what's happening with your or excuse me, iron, copper,
Hmm.
recycling system. What is your microbiome looking like? That's when I would do like further testing to see exactly what's happening. And then sometimes I think people very much like normalize symptoms and um, they don't think to say anything about it. Not that they're trying to like hide it or something. They're like, oh yeah, well I guess I do have like a lot of gas and bloating or yeah, sometimes it's like really hard for me to go to the bathroom. There's a lot of constipation. Um, and so, but I would say at the top of the list would be unknown glycemic issues, glucose issues, like they're on the glucose roller coaster. Thyroid issues are probably really high on the list. And then the anemia, like iron issues, are really high on the list. And then, of course, you have all the male factor infertility stuff too, which people just completely forget about because it's all our job, right?
Yeah, that was going to be my next question. What about the men? What are some of the things that they also need to do? How long should they prepare prior?
So sperm takes between like 75 and 90 days to develop. And so any intervention you do with men, you need at least 3 months in order for them to actually improve like sperm motility, morphology, and concentration. The number one thing for men is there's a few of them. One is weight loss. So men also need to lose weight. When men lose weight, they improve their testosterone levels, their total sperm count increases, their sperm concentration increases. Their insulin sensitivity improves. They lower estrogen levels because they're obviously losing fat tissue, and so estrogen levels are decreasing as testosterone is increasing. Smoking, it's majorly associated with lower sperm count, lower motility, more abnormal morphology. Alcohol intake is a really big one. I see so many men, oh, it's just one beer a night or two beers a night. But even that amount of alcohol, it can lower your sperm count, lower motility, and cause abnormal morphology. And so completely getting rid of alcohol for 3 months would be ideal. Um, Potentially using some antioxidants. So sperm damage, like sperm DNA damage, is actually one of the biggest causative agents of male factor infertility. So we always think about sperm like motility and concentration and morphology, but it's actually a lot of times more to do with the sperm DNA. And I think there's could potentially be a lot of reasons for that, which we've talked about many of them. Like if you've ever gotten into like the DNA adducts research, so we know, that heavy metals and plastics and certain things can actually like place themselves into our DNA and actually change our structure. And so I think some of that happens with men too. So potentially antioxidants men can take to improve that. Your CoQ10, your zinc, maybe the hydrogen. I don't know. I would assume it helps. Reducing or regular moderate exercise is important for men, just as it is for women. Not doing too many saunas. So you don't really want to heat up the testicles all the time. And a lot of men put their laptops, or I guess a lot of people we put our laptops on our laps, and that's just like brutal for testicles. It's going to heat up the testicles and kill off the sperm. So no tight underwear, no laptops on your lap. I just tell men not to do saunas for those 3 months if we're trying to improve sperm. And within 2 to 3 months, you can see improvements. So men can give samples and then make these lifestyle changes, and then 3 months later, their sperm improves quite a bit.
Yeah, so lucky.
So lucky, right? It's so much easier for them.
3 months. Yeah,
Yeah.
I have my fiance on a bunch of things you mentioned, the zinc, the CoQ10. He loves creatine, so he's doing that. His brain works so much better. Obviously molecular hydrogen. What's the other thing I have him on? I have him on one more thing. Oh, human lactoferrin.
Yeah.
Those are like the five things that I'm like, you have to do these every day for the next couple
Absolutely.
months.
Yeah.
Yeah, and I saw that. What is that one guy's name? Brian Johnson. He would do the sauna, but put an ice pack on his package to
Yeah.
counteract the effects.
Yeah.
Yeah. And then how do men affect your like I've seen on social media if you are really nauseous, that's the man's fault. Is that accurate in any way?
Mm, I've never seen that. I don't know if that's true or
Okay.
not. I think nausea potentially has to do with liver issues in the female. I think that was a piece of what was happening with me in my first trimester, because I was getting some like liver pain in the first trimester. So I definitely think there's a connection there. There's a
Mhm.
connection with mast cell and histamine, in the first trimester, that causes a lot of nausea for a lot of women. But I've never seen the sperm connection, so I don't know that one. Yeah.
Yeah, it's one of those myths. I was like, I don't know if this is accurate.
Yeah.
So let's talk about prenatals. How long do you need to be on them? What should you look for in a prenatal? What do you really want to avoid? Are there scams out there?
Hmm. Yeah, you probably want to avoid the prenatal that your doctor's office is going to give you. It probably has folic acid in it, lots of unusable forms of vitamins and minerals in that prenatal. Probably has iron in it, like a ferrous sulfate or something that's going to really clog you up. So I wouldn't use that. And then prenatals, I mean, my ideal situation is that a woman does an HTMA test, and so we can kind of know what nutrients that she needs. But in general, you want to look for one that's probably methylated. Again, in the chronic illness world, there's caveats to that. But probably methylated, you're going to want methylfolate in there. You want at least 800 micrograms of methylfolate. And then you want to start at least 3 months before trying to conceive so that you can build up your folate stores, to prevent, neural tube defects in the baby.
And what about like folinic acid? Is that one okay, or do we need methylfolate? Because I've seen a lot of people say there's no research on anything but folic acid for preventing neural tube defects. So all the functional people out there saying take methylfolate are wrong. But it's like, okay, what you tell me, what do you think is like not necessarily the difference, but what's the risk like between the forms?
I don't I mean, most of the research is done on folic acid because that is what's prescribed. And those, like when you get prescription prenatal vitamins, like you go to the pharmacy and pick them up, that's the only option. There isn't one with methylfolate in it. So I'm sure there probably isn't literature about that. I mean, just from a like knowledge of the body perspective, methylfolate is much more absorbable. And so I don't really understand why they would make those comments about about methylfolate when we know that it's a much more we assimilate it much better. I would imagine, I don't have a study backing this up, but that we would be able to see an increase in folate, like doing like a red blood cell folate levels by taking methylfolate. We would probably see improvements more on that than doing a folic acid. But I mean, that's just in my brain. I don't know that I've ever seen a study on that, but it would make more sense to me.
Yeah, that's kind of how I view it as well. I think it's just MDs that push back, like there's no research on that, so why would you do that kind of a thing happening? And then also in supplements for pregnancy or prenatals, I've seen an increase in like supplements that say they're going to improve ovarian egg quality. Is
Mhm.
there anything out there that you know of that would do that?
So coenzyme Q10 for sure. I think that's one of the most studied nutrient out there on
Mhm.
improving that. But also a lot of the studies on improving like AMH, improving ovarian quality are about removing things. So, not to go back to the heavy metal thing, but there's just been a lot of studies coming out from 2020 to 2025 on it, looking at how it affects AMH, looking at and they're using blood markers, and so they're not even using like HTMA, and so these are women with elevated like mercury markers and cadmium markers, and so and they were like chelating women, so we would obviously be doing it in
Yeah.
a much safer and more ideal way by adding in nutrients, but removing like the blocks to why they're not developing appropriately, I think, probably works better. But some of these nutrients are mainly antioxidant based, so like your zinc and CoQ10, and so the molecular hydrogen should do the same. And then I always am like, cautious with antioxidants because you can absolutely tip the scales for people and people can overuse antioxidants. Um, but I think, a lot of these studies that are done in like big fertility clinics looking at these like single nutrients, it's like they're focusing on this one single nutrient and then looking at correlations with, is somebody more likely to get pregnant? So it's like a correlation model. But they don't really know why that is, right? Like they're just saying, oh, it's reducing oxidative stress. But like, why does somebody have oxidative stress to begin with?
Yeah.
And so, yeah, maybe you're improving the oxidative stress temporarily, but you're not really like improving somebody's health necessarily. But yeah, I mean, CoQ10 is probably the most well studied. Zinc is really high up there. Selenium, vitamin E, vitamin C, all of those have been studied to improve egg formation.
Mm. Yeah, that makes a lot of sense because if you think about like why is your body producing oxidative stress? Well, toxins may be one of them, but then there's also that mitochondrial piece
Yeah,
and the reactive oxygen species that are being produced if your body doesn't have enough minerals or B vitamins or CoQ10 or light or oxygen. And all of
exactly.
those things would help you get out of that vicious cycle of not producing that energy.
Yep.
Let's go back to just the general like shifts that happen in your body during pregnancy. And here's where I want to kind of bring up histamine and mast cell and connective tissue stress, because this is what I'm the most worried about. So it's kind of a personal question.
Yeah.
If you already struggle with these things like histamine symptoms, or you've had mast cell, or you have connective tissue hypermobility, or full-blown EDS, what are some of the changes that you could experience during pregnancy that may be a little different than somebody who doesn't have those issues?
Yeah. So with mast cell histamine across the board, I generally see the vast majority of people improve during pregnancy. And the reason for that is because during pregnancy, placental DAO levels actually rise. So they assume this is like a protective mechanism for the baby so that the baby doesn't, receive so much histamine. Like your DAO levels actually rise by like more than 10 times what they normally are when you're not pregnant. And so there is this kind of protective mechanism around histamine. Also just the rise in progesterone helps to stabilize mast cells. A lot of women like even will take supplemental progesterone and be like, "Hey, I think my mast cells actually improved a little bit with it." And so that makes sense too. I think the problem with mast cell comes more in the postpartum period because our progesterone rises really rapidly in the first trimester and then it plateaus. And then postpartum, it's like crash and burn, which is part of the, emotional changes as well. And then estrogen levels start rising again. And we know that estrogen is highly connected to sometimes histamine and mast cell flares too. Um, and so during pregnancy, women generally feel much better. Like some women, I'm not going to say they get addicted to pregnancy, but some women are like, man, I wish that I could just be pregnant again because I felt amazing. Like all my autoimmune symptoms went away. But mast cell specifically, it's probably because of these two rises in progesterone and placental DAO. And then, kind of um, the other stuff that happens with like EDS is you're thinking we're already releasing that hormone relaxin, and so all of our joints and everything is much more relaxed. We're much more prone to accidents and injuries because of that. SI joint pain, sciatica, and so EDS people are more prone to that. They're also more prone to very, very fast labors, which sounds really nice, but it's really overwhelming. Like women that have 1 or 2 hour labors, it tends to be just like you don't have time to assimilate it. And the baby oftentimes comes out in shock too because they don't get that like squeeze effect. And so sometimes they come out kind of floppy and it's difficult to get them to cry and, kind of wake up. So it's not ideal to have these very, very short labors. And then tearing is more common in women with EDS or just like collagen issues. So they're more prone to like third and fourth degree tears, which of course is not ideal. If that were to happen in a home environment, you'd have to be transferred to the hospital to have a repair done there. Um, and so those are some big things I see.
Are C-sections more common or less common in this population?
I would say less. I don't have statistics, but I would assume less just because the labors go really, really, really quickly.
Hmm.
It's like
Yeah.
from first contraction to baby out, it's really quick. I think that
Yeah.
also contributes to some of the perineal tears too, because there's not that time with pressure, from the head on the perineum to like slowly stretch. And so if a baby comes out really fast, you're just more likely to have
Hmm.
tearing.
Yeah. And is there anything you can do to prepare for that prior?
I mean, all the stuff we've talked about, like
Yeah.
improving mineral stores and nutrient density and also, I don't know how much it would matter in the with the perineum, but making sure, like Alex in my clinic, she talks a lot about because she has EDS, just a lot about how to activate kind of the smaller muscles so that you have better integrity around the joint spaces and places that you would generally have more laxity. So I think doing that throughout pregnancy, like specific exercises to make sure that you have better support around the joints. In terms of the perineum, it's there's not great literature on it, but some women do like stretching in the last trimester, like starting around week 35, where you just take
Hmm.
like a little bit of coconut oil or olive oil, and then you just place two fingers like in the vagina and just hold pressure down. You're not going like this around the vaginal openings that can cause tearing and inflammation, but you're just putting a little bit of pressure. A lot of like old school midwives still do this. Some of the literature says that it causes more damage, but I think those are the women that are really aggressive about it. So I tell women when you put the two fingers in and pull down, you should not be having any pain, like at all. And a lot of times the partner will just do it too. And so I think that can help just kind of stretch some of the tissue, anticipating that maybe it will be a faster labor. Um, but yeah.
Hmm. And then in this population, I know this is like a personal decision for everyone, but would it be wise to be in a hospital setting or it's kind of up to that person in that pregnancy?
Yeah, I think it's up to the person. I know free birth is kind of becoming a whole thing and I have my own feelings about it. I probably wouldn't free birth if I had EDS. You also have a higher risk of postpartum hemorrhage just because of like perfusion issues, like uteroplacental perfusion issues. And so I would want somebody there that was skilled and like actually had medications that they brought with them in case an emergency would arise. But if you're going to do a hospital birth, I would say that it really has to be a good setting for me to want to do that in.
Yeah.
I I was lucky because I worked in Alaska, and so I worked at a really small hospital that was extremely pro woman, pro midwife, and almost the midwives did the vast majority of the deliveries at the hospital. Um, but having been in other hospital settings where that's not the case, it can be kind of scary.
Yeah. Hmm.
And so I would just tread lightly if you're going to choose a hospital system.
Yeah, and what are some of the things to kind of look out for, at least prepare for, like for a birth plan? If somebody wants to, okay, I want to maybe do a home birth or in a birthing center, but have a hospital close by. Like what are some of the things that maybe a midwife or somebody could help you kind of plan and what are some of the questions that you kind of need to know the answer for before going into all that?
Yeah. I think birth plans, if you're going to have a home birth, um, not that they're not worth it, but generally the midwives who do home births have already, like the things that you're going to put in there, like not have continuous monitoring, not have vaginal checks every 2 hours. Um, Most of them don't do that anyway. They do the Doppler every once in a while when you're in active labor, like every 20, 30 minutes or so. But
What's the
outside of that,
Doppler?
sorry, a Doppler is are you when you listen to a baby's heartbeat with a Doppler.
Okay.
Um, and so they're not usually doing these interventions at birth centers or at home, I would say.
Hmm.
If you're going into a hospital system, then you would want to have all of those things written out. Like, I don't want vaginal checks every hour to 2 hours. It increases infection rates, increases rates of C-sections. I don't want continuous monitoring. You can do spot checks according to hospital policy. You want to ask what the hospital policy is probably before going to the hospital so you know what they are required to do. There are things that you can opt out of I mean, I guess you can theoretically opt out of everything, but it is really stressful to go into an environment and be like, I don't want any of those things, and then being like, well, you have to have them, and
Yeah.
then the whole war, and then you got to sign all these papers while you're in active labor. It's a real, shit show. So, um, I would say that. And then if a midwife is coming to your house, so there are different types of midwives. There's certified nurse midwives, there's certified midwives, and then there's like lay midwives. And so they all have a little bit of a different training set. Certified nurse midwives are the only midwives that are allowed to carry medications. So that's something that you would want to ask, like, what is somebody's certification? Do they bring medications to a birth? Do they bring oxygen to a birth? Are they certified in neonatal resuscitation? Are they certified in CPR? What would be like an emergency strategy? Like if they felt like you needed to go to the hospital, like how much time do they give you? Are they calling an ambulance? Are they bringing you themselves? Like what does that route look like? Um, you would want to make sure that it was very clear that you do have EDS, and so you're worried about tearing. If you did tear, what would that look like? What would the transfer look like? Um, Things like that. So
Anesthesia.
anesthesia. I mean, if you're transferring to a hospital, your birth plan is out the window, right?
Yeah.
It's what I tell women. I'm like, you can bring that, but if you're transferring for anything other than inability to tolerate pain, the pain, and you're desiring an epidural, if you're going for an emergent reason, there's no reason to have a birth plan because you're going and they're going to do what they do in order to save your life or the baby's life if that's what it comes to.
Yeah.
But if you're transferring because of an epidural as well, like then continuous monitoring becomes required. Like I don't know, I guess you could opt out of it, but it would be a whole conversation, it'd be a whole to do. Continuous monitoring, like you're under anesthesia at that point, so you're not able to move your legs. If you have to go pee, they're gonna have to catheterize you. And so these are things, this is like the things that are just going to happen, and there isn't like an option. They can't let your bladder explode, like they need to catheterize you. So I think once you go to the hospital for some reason, then there is this kind of cascade of interventions that people should be aware of.
Yeah.
But you can still do things like let's say you're going to the hospital just for an epidural, but not for any emergent situation. Baby's fine, you're fine, labor's progressing fine, but you just decide you want an epidural. Then you can still bring in your birth plan and say, hey, this was my plan. I'd rather you not do vaginal checks on me unless I ask for one. If we can avoid continuous monitoring, you can try that, although with epidurals, they usually require it. That you're trying to avoid a C-section at all costs. You can still say those things as well.
Yeah. So all this sounds really scary and a lot to deal with. What are some of the things you talk about for like that emotional side of things and mindset? And you said something really beautiful before we started, like your body just knows what to do. You don't
Yeah.
have to control it. You don't have to micromanage these things. It unfolds exactly the way that it needs to unfold. So do you have those conversations also? Like what are some of the topics you guys talk about?
Absolutely. And I think we're talking about the scary stuff because we're talking about like worst case scenarios.
Yeah.
But like in my entire 8-year career, I had one emergency and I have
Wow.
delivered hundreds of babies. Like one true emergency, right? Where we're like, oh my gosh, this is bad. We're going. And even in my training, we had one. It wasn't even my patient at the time. We had one. She had an eclamptic seizure. It was a terrible situation. It was very sad. But so we're talking like hundreds of births that went totally fine. First babies, second babies, third babies, no issues, no medications given, no C-sections, no epidurals. Like this was more the norm for me. And there was a point in time where I delivered like 25, 30 babies a month. And I mean, I rarely had any issues. And so the truth of the matter is that women's bodies just know what they're doing. And I think when you go into this, super prepared, like you've done all this health work, you've done all this stuff around your health and your mindset, then even better. But women's bodies are meant to do this. Like they're meant to do this. It just happens. Your baby's not too big. It's gonna fit. That's like a huge thing that doctors like to tell people. Your baby's too big. It's not gonna fit. If you had raging gestational diabetes, maybe there would be issues, but for everybody else, the babies just fit. Um, and so we have instilled so much fear in women because yes, emergencies do exist in every like that's just life. Crossing the street, there are emergencies. People get hit crossing the road. And so is that possibility there in the field? Yes, it's there. But it's extremely unlikely. Like extremely unlikely. And so I think the hardest piece about birth is that people already have this idea of what it's going to be like because they see it on TV. And it's like, even if you go through, like, I don't know, the Friends episode, right? Like, I think when Jennifer Aniston was like giving birth, she was like screaming, right, at the top of her lungs. Like, we just see all these women screaming all the time, and it's so painful and horrible. And it's really not really like that. And so I think women have to come to a place of like rewriting that story of like what birth means to them, what emotions they have around birth, like really feeling into that, which I know you're so good at. You teach people about this. Um, and really like visualizing and asking for the birth that they want. Um, because all of that makes such a big difference. Like if we're in a fear state, we're clamped down, right? And so it's like this learning process of how to stay open in the presence of some discomfort, which
Yeah.
is one of the benefits of having chronic illness before pregnancy because we've been through an incredible amount of discomfort. And you can either keep fighting that and be uncomfortable and be fearful, or you can just be like, okay, well, this kind of sucks, but I'm just going to surrender to this sensation. And that's kind of what birth is. It's just a surrendering process and like deciding a decision that you're not going to be afraid.
Yeah, very well said.
Yeah.
And even though I agree, I still have that fear in me. So I'm still kind of working through some things. And I'm sure a lot of women can relate that have had that experience of like, you've already gone through where you became a whole new person, your identity shifted, and motherhood is on another level. So it's like, okay, now I have to prepare to go through that again. And I think that's also part of the like aspect of the women we both probably work with is that anxiety about not having control and having to surrender that we resist so much about some of these things.
Yeah.
So it's definitely a process. And then afterwards, like we were talking before, then you have to opt in to just not have sleep for like a year at least,
Yeah.
preparing for that and making
Yeah.
sure you've got like the support in place. And some of us might not have that family, friends, things that are going to support you afterwards. What is your postpartum going to look like and feel like? Having to recover from all that again, and it can be really overwhelming. So I love that you put that, your body is meant to do this. It's going to be okay.
I mean, it's even the same postpartum. It's like we've created this script around how awful all of it is, right? Growing a baby,
Mhm.
delivering a baby, the first year of the baby's life. And I'm not saying it's not hard. It's the hardest thing I've ever done in my life. I mean, there was point in times where I would look at Mark and be like, I think I think I'll just repeat chronic illness. Like this is really hard. And then of course there's like an extra emotionality in it. It's like you just the mother bear comes out and you just it's like anything in your being to like protect this child. And so I think there's this other like emotional state that you go to. But also it's just like we've just created this whole script around how awful it is. And yes, you're gonna have some sleepless nights. But part of the awful is because we're also trying to do everything else while we're trying to mother. And this is where like hunter-gatherer tribes and all of these people do it differently because like they protect the mother. And the mother and the baby are in this bubble for months on end. They are getting served food. They are not doing anything else but raising this baby. And so the part that's hard is having to do all the other things. It's not really the baby raising piece. And that's what I found for myself too, is like just this divide in mind of like, oh, like I just want to go be with my son, but like, okay, like I do have to work and like make money and it's I think that adds some stress. And then the whole lack of village thing is the biggest. So I mean I saw this for myself and it's something I talk about to women all the time is like you need to have support and help because it's just like asking for mental health issues in the postpartum period. Like I don't know, stretch the budget, get a home cleaner, find somebody who can do some cooking for you or, at least clean up after you've cooked. have like I had 3 months of meals prepped in my freezer for postpartum, and that was like life changing. Like I didn't have to think about what I was going to eat, and because when you're in it, it's like thinking about making a whole nutrient dense meal just sounds awful.
I
Awful.
feel like that already. So
I feel
that
like that already too. Um, so the more help, the better, which I know is sometimes not possible, but
yeah. So definitely things to prepare for though.
yeah.
I had a few other questions like for big no's during pregnancy, because this is one thing that I'm like, okay, when I'm pregnant, I'm not going to be getting on an airplane. And I see so many people doing that. And not recently, I think the mentality has shifted, but 5, 6 years ago, women still being like, can I parasite cleanse or can I take this mold detox while I'm pregnant too? So if there's like maybe like a few things that you see people doing that you're like, oh no, please stop, don't do that. What would be the things on that list?
Um, so I don't, the airline thing, I flew once when I was pregnant. So when you look up the actual like number, I don't remember what the unit of measurement is for like radiation, but
Mhm.
it's like one short flight, like 2 hours or less, is less radiation than a dental x-ray.
Oh
And then
wow.
a long haul flight is like the same amount of radiation as a chest x-ray. So a little bit more. And you would have to fly like between 100 and 200 times to even reach the amount of radiation of like a CT scan.
Yeah. Okay,
So I
that's
think
comforting.
So, yeah, I mean, I don't think I would fly like all the time, but
Yeah.
and I try to not get women to fly like in the very early first trimester, and then obviously in the last trimester more for like delivery issues. And then like with EDS, because there tends to be more blood pooling, you do think more about like blood clot risk or a VTE or something in the leg. Um, but I think airline flying could be okay. So
Yeah.
yeah, and then saunas, I don't know why women do saunas in pregnancy. Like there actually is literature around this, like showing that it can cause fetal defects, and so I don't recommend any saunas. You can do some red light therapy, but on your back, mainly because we just don't know. I haven't seen any studies coming out. I'm sure there will now because so many people are
Yeah.
doing red lights, but I haven't seen anything. Um, but I tell women you can do it, but just make sure it's pointed at your back. Um, Obviously smoking. I worked with a really like a Medicaid population, so I saw all of it.
Yes. I've
But
worked with that population before as well.
yeah, so we got like Coca-Cola in bottles, when the babies were born and
My boyfriend was given Coca-Cola in a bottle.
insane, right? Insane. So obviously the normal stuff like drinking, smoking, are not good. But in the wellness world, really like any sort of cleansing, intense detox, you're not doing that in
Mhm.
pregnancy. I've had women come to me and they have like diagnosed SIBO and things and they want to like do SIBO protocols and I'm like, we can do some prebiotics and like a probiotic and that's kind of as far as we're gonna go with that. There are definitely herbs you can and cannot take. I have like lists that I'll hand out to women of things that you can and cannot take depending on the trimester. But yeah, lots of people trying to detox in pregnancy, which I don't really understand where that came about, but none of that. Coffee enemas, people ask me about. I did a couple of them in the second trimester. I wouldn't personally do them in the first trimester. And then in the late third trimester, it's just hard to get on the floor and like put something in your butt. But so I generally tell people like probably you don't need to do a coffee enema. And let me think, other wellness things.
Cereal packs.
Castor oil packs, no. No. We back in the day, and some midwives still do it. And they have women drink castor oil to put them into labor. I do not recommend it. That was one of my worst birth stories ever. And it was a lovely birth. Like the baby was fine and mom was fine, but she just had diarrhea the whole time. So I don't recommend that. But it can get you into labor. Um, Yeah. So you're not really doing a whole lot. Like you're meant to just focus on growing the baby, which takes a whole lot of energy. So nutrient density, minerals, that's all you really need.
Yeah, that kind of brings a good point. You mentioned like taking castor oil for going into labor. Why would you want to force yourself into labor? Or do you always want to wait until baby's ready and your body does it for you?
You always want to wait.
Mm.
hmm It's another thing with the hospitals, like they'll do these like late third trimester ultrasounds and be like, your baby's huge, you should induce. And then the baby comes out and
Yeah.
it's like 6 pounds, 10 ounces, it's like, okay.
Aw.
So third trimester ultrasounds have like zero validity to them, just FYI. Like they cannot measure your baby on a third trimester ultrasound. Like they just cannot do it. Nor do they know what changes are going to happen in your pelvis when you go into labor. So our pelvises widen, they stretch, they make way for the baby. Um, so yeah, you just you don't need to be induced. Some women will do like sex, that can be helpful, but sometimes it just causes a lot of cramping and discomfort. But the semen will actually soften the cervix, and so it can be a little bit helpful if you're wanting to get things going, like you're in week, 41 or 42, have sex. Although some women look at me like I have three heads because most women
Mhm.
don't really feel like having sex in the late third trimester. Um, but really, all you need is the semen, so it doesn't have to be amazing sex either. It could just be a quickie and you get the semen and that helps your cervix soften. But like forceful things, like some people use like black and blue cohosh. I don't really recommend that. Castor oil, I mean, it can get you into labor, but you'll probably have diarrhea the whole time, which is not great. Um, People do the walking, like put one foot on top of the curb and then one foot down, like this awkward walking. I don't know. Some people say like
Yeah.
eating spicy foods, all these things, but I don't know that there's any validity in those things, and the baby just comes. It just comes. And first pregnancies
Mhm.
tend to be a little bit longer than second, third pregnancies, and so I had just sort of had the mindset like, oh, I'll just go to 41, 42 weeks, and I got lucky. He came right on his due date, but
Wow.
it's not unusual.
Yeah, because I was a C-section and I always want like I've asked my parents why, and they're basically like, you were taking too long. I'm
Yeah,
like, well, I wasn't ready. Like, why? What's the medical reason? Was there anything wrong with me? No, you're just taking too long. I was in the
exactly.
hospital for a long period of time. Yeah, and just like to your point, like it's been medicalized and it has to happen in this amount of time and in this way. And if it doesn't, then we're gonna force it to happen in this way. And just seems very opposite of like what femininity and birth is kind of supposed to be, like the energy of it.
Yep. What became a male-dominated field in the early, 1900s when women like started moving birth into the hospital system. It wasn't
Mm,
until like 1920 or something that we really started doing that. And then it was the whole time period of like giving women essentially like chloroform, like putting them into like a twilight state, and so they don't even remember their birth, like tying their arms, like covering their eyes, and then like taking the baby out with forceps. I mean, this is how, but it was sort of touted as like the hospital is this sterile, perfect environment to enter the world into, and we know that that's BS.
yeah.
And most C-sections are done at 5 p.m. on Friday. So it's
Mm,
like the doctors, they just want to go home and be done with it, go have dinner with their family, and that's just it's an industry, just like
yeah,
all of the medical system.
right. Yeah. And before we finish up, speaking of that medicalized birth, what are the interventions that the hospital tries to kind of force upon you, or like the antibiotics in the eyes and stuff that happens like when you're in the hospital that you have to kind of prepare your answers for?
Yeah. So the hepatitis B vaccine, although did they just get rid of that in the US? I think
I
there was
think
talk about it.
they took it out of the like forced the schedule.
Okay.
I don't know if
So,
it's state by state or what.
okay.
So.
Because here they don't, in Europe, they don't do the Hep B vaccine, but you get that option in the US. You get the option of the antibiotic eye drops. And if you don't feel you're at risk for a sexually transmitted infection, then you can decline that because there's no other reason for it. Um, if you feel like you're at risk for gonorrhea or something, then I would recommend it because the baby can have blindness if they were to contract, gonorrhea. They do lots of vaginal checks, like every 2 hours. They do vaginal checks. There was a point in time where they really tried to medicalize everything, where they would have this chart of like, oh, if you're not dilating a centimeter every 2 hours, then you're slow and we need to speed things up, which is just wild. Like as if we're just like a perfect graph, like the human body. So they would do that for a while, lots of vaginal checks every 2 hours. Every single vaginal check increases your risk of infection and increases your risk of C-section. And so limiting them to like the least amount humanly possible or none is ideal. Women just know when they need to push, and you can see it if you've seen birth more than one time. You can see when a woman is ready to push. um, Sometimes they'll say, oh, things are going slow, and so we need to add Pitocin, which is a synthetic oxytocin that speeds up labor, but oftentimes makes the contractions much closer together. And so there's a lot of times fetal distress that comes with that. And then when there's fetal distress, they say, oh, well, now the baby's upset, and so now we need to go to the OR and do a C-section. So knowing that that is something they do, obviously inductions, especially in a first baby, like you just don't want to be induced in a hospital system with all those medications with the first baby. The likelihood of C-section is huge. Um, Other interventions would be continuous monitoring. So babies will naturally have heart rate dips from time to time when you have a contraction, because you can imagine every time you contract, the oxygen and blood flow that goes to the baby diminishes slightly, and then as the contraction ends, all of the oxygen comes back to the baby and the heart rate normalizes. Right? If this is really severe, like you're having these huge heart rate dips, okay, then there might be an issue of fetal distress there, and we might need to look into it. But continuous monitoring, it's almost like doing all this like preventative care, when we started doing mammograms and now we just find lumps and bumps in everybody and we're putting tags and we're doing biopsies, and it's kind of the same with the continuous monitoring. Like, oh, there was a dip there. Maybe the baby's in distress, whereas it's probably just a normal physiology and the baby's rebounding and fine. And so sometimes the more information, it does not mean that it's better.
Yeah,
So those are some of the biggest interventions. And
that
then
makes sense.
separating mom and baby after birth. It doesn't happen as much anymore. Now hospitals can get, I forget what it's called. It's like some sort of like mom baby friendly hospital or something like that.
Oh, okay.
It was like
Like
a
how
bit,
they do skin to skin.
yeah. So it's a big initiative, and some hospitals have this certification and others don't. And so if they have the certification, then they leave the baby on mom for as long as mom wants. Um, but sometimes they'll separate baby, and so that would be something else you would put in your birth plan, that you don't want baby to be separated from you ever at any time. And then cord clamping is a big thing that people will put in a birth plan, or sometimes they do that intervention without you even realizing it because you're so, engrossed with your new baby, and then they're clamping and cutting the cord and you don't even know that it's happening. But you want the baby to stay attached to the cord for at least a few minutes post birth until the cord like goes completely white and just totally limp and there's no blood flow. Then you can clamp and cut it.
Perfect. I think that you've kind of calmed a lot of my anxiety about this and questions, and just like anything, like the unknown is scarier to me than, all these things I've studied in the past. I'm like, no problem. So I definitely still have some like somatic work to get through, and, visualizing, like you mentioned, everything going smoothly and everything working out for me.
Absolutely.
Last question is about age. So there's been a study that came out recently that showed that women's eggs are actually really protected, and like it's not actually your eggs that are declining as badly that we once thought into like our 40s. And then also that women who have babies later in life actually have a much longer life, usually like four times as
Yeah.
getting to 100. So why would that happen, I guess? Like, Is it because of stem cells and what happens when we're pregnant?
I think maybe um, when I read that about the longer lifespan, I sort of just assume like children keep you young.
Yeah.
Like I think they require so much energy and so much yeah, just so much energy that I think the people who have babies later as well, they're generally healthier women or more aware women of like health stuff.
Hmm.
Um, and so I've even found myself being like, I could see how that would be true because I think sometimes people think, oh, you go into your 40s and 50s and you're already slowing down, right? I mean, even like the 80s and 90s, all like the movies were just people looking like they were 80 years old and they were like 40. I remember when my dad turned 40, we had a party for him and his cake was a cemetery with like a like a skeleton in it. And now that I'm 41, I'm like, oh my gosh, that's horrible. But so I think we think of like our 40s and 50s as like the end of our life. But if you have, like a 2-year-old at 45, then it does keep you young. So I don't know if it's more of a physiologic thing or more of like a mental emotional thing.
Maybe. Yeah, probably both.
Yeah.
And then the ovaries or the egg quality kind of being protected. My grandmother lives next to somebody who had her sixth baby at 52 years old.
Wow.
She looks incredible. And I was like, Grandma, are you sure she's that old? And she's like, yes, she's 52 years old.
Okay, well that's definitely on the far end. And I mean, I have totally changed my mindset around when we have our children living in
Mm.
Europe because in the States it's like people have babies like in their early 20s and here that you never see people in their 20s having babies in Europe and I am like one of the younger moms in Luca's class and I'm
Oh,
41.
wow.
So one of the moms
Wow.
turned 48 this year. Her son's the same age as Luca, 3. And I just like everybody in his class, all of the moms except for one are in their 40s, which
Wow.
blows my mind because like if I were to go back to the States, I would definitely be the old mom for sure.
Yeah.
So it totally changed my perspective. And like even if you like talk to women in the streets, they have no concept that like having a baby here at 42 is old.
That's good.
Because I've made the comment like, because people are asking, are you going to have a second baby? And I'm like, no. And like, I'm 41 anyway. And they're like, yeah, like, what does that have to do with anything? Like, why are you saying you're 41?
Mhm.
So
Interesting. That's good to know. What is like old there to have a baby then?
I would guess late 40s because so many are still having babies at 43, 44, 45.
Yeah. Interesting. That's really nice, though. I think that's getting more and more common here. Like almost none of my friends had kids, and now some of them are starting to talk about it. Or my best friend just had a baby last year, right before she turned 40. And it's like we grew up really slowly, kind of. Now we're just finally like, okay, we're old enough to do this at 40.
Yeah. I mean, I still didn't, I was 37 when I got pregnant with him. And I was like, am I old enough for this? I
Yeah.
remember thinking like, huh, can like, I still felt like so young.
Right,
Like,
exactly. Who is gonna let me do this?
yeah,
Yeah, I think that's a common millennial quality that we all have is just feeling really young still.
absolutely. I think it's good though.
Mhm. Yeah, I like it. It's
Yeah.
fine.
Because the boomers all felt old at 40, so
Exactly. Yeah. Yeah. I mean, I don't know how old your parents are, but mine are 67, 68, and they're doing great. So it's like they reached their old age early and kind of stayed in that young old age. I don't know. I don't know how to describe it. All my aunts and uncles, same thing.
yeah. Yeah, I don't know. My mom's she's 68, my dad's 77. They I don't know. They're okay. They're hanging in there. It's interesting. Like I had this conversation with a client the other day. She's one of my older clients. She's 71, 72, and she does mineral balancing with me and she just like eliminates like left and right. It's like her body is just so vital. Versus like in some of the younger people I see, it like takes forever sometimes for them to start doing any sort of eliminating or seeing shifts on minerals. And I just was thinking, like, I just think the boomers and then what is the generation before the boomers?
The
Gen-
silent generation.
Okay. And then, because I did see someone who was like in her 80s too, and it's like she didn't start having any symptoms until like her late 70s or early 80s. And then
Yeah.
like the boomers, they're kind of starting to have symptoms now, right? In their like late 60s, early 70s. And
Mm-hmm.
then our generation, it was like 20s, 30s, we were having
Crash
symptoms.
and
And
burn. Yeah.
now all the children are like crashing and burning.
Mm-hmm.
Um, so it's just, yeah, it's just like you can see just the emotional toxicity passed down through all the generations, but also all this physical toxicity and what
Mm-hmm.
that's doing.
Yeah, exactly. And I think to your point, like this is going to keep shifting. There is like a change in not necessarily government, but the people kind of having better sovereignty of their own health and taking charge of it and reaching out to practitioners or alternative space to kind of prepare for these things. Whereas like our
Yep.
parents probably did absolutely nothing.
No, nothing.
Probably
My
got
dad was
drunk
smoking.
one day and then boom. So yeah, there's definitely a big shift of like people wanting to actually control is a harsh word, but yes, control, but also kind of take sovereignty and accountability for like, okay, let me actually take this seriously and try to do it right.
Absolutely.
Awesome. So tell everyone where they can find your courses and everything on fertility.
Yeah. So I have two Instagrams. I'm at two purple carrots for like complex chronic illness stuff. And then my other Instagram is the Femme Design. And I have a fertility course called the Femme Method. And we just go through, there's 19 modules and there's like 30, over 30 hours of content in there, which sounds like a lot, but you take it just step by step. And people can do it anywhere in their wanting to conceive journey, but I tell people like ideal would be a year before, if you can. And that way you have time to kind of work through the modules. And like I go into even just things like making sure your home environment, right, is healthy, like thinking about the
Hmm.
EMFs in your house and mold and humidity levels and those sorts of things too. And so some of these things, you know, require some time if there's issues there. Um, and so you can find that course there. And then all fertility, preconception, pregnancy stuff is on the Fem Design account.
Perfect. And your website?
Website is twopurplecarrots.com.
Why did that name? I've always meant to ask you.
You know, like 10 years ago when I started the account, I thought I was just going to focus on nutrition, like nutrient density, which I don't even know why, because I don't even like, obviously I like food and nutrition, but I don't even, like, I'm not even a foodie. I eat the same like foods all the time. So I
Yeah.
don't know why, but I was like, I'm just going to focus on nutrition and help people with that. Because I just come out of working with a medicated population, just feeling like, like no one knows even what like a macro is in this world. So then I just came up with like a cute name. But then people started to like ask me questions about complex chronic illness. And then I just started like doing that. But then people already knew me as Two Purple Carrots. And I was like, well, I can't change it now. So I just kept
Yeah.
it, but it has no meaning at all.
Oh, that's hilarious.
Yeah.
Okay,
I
great.
I wish I could change it, but oh well.
You can. People would catch on.
Yeah.
All right. Well, this has been a really good conversation. Thank you so much for joining me. Is there anything else you'd like to add?
No, I think that's it. But I just wish we could rewrite the birth story because it really is a beautiful thing. And
Mhm.
I wish you the best on your pregnancy journey. I
Thank
know
you.
that's maybe coming up for you at some point, and yeah, I'll definitely be sending you good wishes and prayers and all of that.
Thank you. Thanks. I really appreciate it.
Yeah.
All right, everyone. Thank you so much for listening, and I will see you all next time. Have a good day. Bye.
Thank you, everyone. I am just so thrilled that you're listening to the Healer Revolution podcast. This has been a huge passion project for me and super therapeutic on top of that. helping me to use my voice and connect with other like-minded individuals. So if you're enjoying the podcast, please like and subscribe. Please share on social media or with your audience or friends or loved ones. I truly appreciate it. It does take a lot of time and financial costs to run the podcast, and it is not a moneymaker, let me tell you. So if you are enjoying this, I would truly appreciate your support just by sending me a post, a like, and a subscribe. Thank you so much.